viruses, and that's where we injected this in. So, and I thought that as fast as things are changing, it's better to provide you with some links of where you can get credible information rather than to go through a lot of stuff just to find out next week that it's not necessarily correct. So the sheet that's being passed around, if you want this, I have it in an interactive PDF so you don't have to copy down all the URLs, but I'll go through this, and if you want that, I will send it to Harold, and he can just send it as an email attachment for you. So just let us know, and I'd be glad to provide that for you. A couple of definitions in terms of classification. It's in the family Filoviridae, in which there are two genus groups that affect humans. One is Ebola virus, the other is Marburg, which also produces a hemorrhagic fever in developing countries, and especially Africa. But we'll concentrate here. There are 5 types that have been identified. The Zaire type is the one that is causing the problem in West Africa now. So originally, they were discovered in human in 1976. And so there were outbreak of 2 types, the Sudan type and the Zaire type, which is now DRC. And one of the areas that this affected was near the Ebola River, hence the name. So it's been called the Ebola virus. And the Zaire type is the most virulent, with cases up to 90% fatality. So some of the other types are anywhere from 20 to 50, 60, but the Zaire type, unfortunately, is the most virulent. So let me just mention a couple of things, because it's not in here, but the virus affects the inside lining of blood vessels, what we call the endothelium. And so it affects them in a way that prevents the cells from repairing itself and maintaining itself. So it gets leaky, and hence the hemorrhages. And hemorrhagic, in Ebola virus, is a hemorrhagic fever. Most of the hemorrhagic fevers, like dengue, are going to operate that way to one form or another. Ebola virus also, and especially the Zaire form, attacks not only organ systems, causing the symptoms that we get, which I'll just mention in a minute, but it also inhibits the immune system by multiple ways. So, for example, interferon is a normal substance needed for our immune system to work, and it prevents its production, it prevents its getting into the cell, and once it gets into the cell, it also prevents its operation. Wow. So not only that, but ordinarily it uses circulating antibodies to actually help it bind to cells. And it also, in each cell, there's the genetics that determine what we call programmed cell death. So each type of cell has a cell life. Neurons are different, but all the rest of the cells have a cell life determined by the genetic programmed cell death, a gene that causes that. This virus speeds that up, so it initiates faster death rate for cells, and also the cells that are part of the immune system, like macrophages, that go around in the body looking for foreign substances. It kills them. So it takes a long time for the immune system to start to work. And if you're malnourished and you're dehydrated, then you're probably you have a less chance of surviving. So anyway, with those things in mind, this is a link. The link is there. It's already updated, and I'll say a word about this. If you're working in the areas, this is updated, I think, weekly. You can see this was September 3rd. There's one that was updated last week. And so it's on the USAID website, and it's listed there, but it's listed as 314. So just go to the main USAID website, and I'll talk about that in a minute. And then this will be updated every week. So if you're interested in numbers and who's doing what where in terms of the different groups coming in to help, so that's good. So mode of transmission, a lot of controversy, and like any crisis, when the media gets a hold of it, you don't know where you are because there's a lot of misinformation coming out. They have maintained, both the CDC, Center for Disease Control in Atlanta, and World Health Organization is supplying information from around the world, have maintained that it is only by direct contact. World Health Organization, the last week of August, in one report I read, said that possibly indirect. They're still saying not airborne, but part of the problem with this is we don't know for sure. And it is so virulent, but the rationale for saying not airborne is that the cases where there have been people infected traveling by plane, other individuals have not been infected. So that leads them to think that it's still not airborne. But the thing about this is it's mutating. It's mutated. I've read some reports that have said 300. I don't know where their data is, where they get that. But it is mutating. And that's a common thing that happens anyway with virus infections.
Mutating means what, please?
I'm sorry?
Okay.
Molecular changes.
Okay.
And so, yeah, I'm going to say. So direct contact, they're still holding that, but a possibility for indirect, not airborne at this point. And they do not know how long the virus can live outside the host. They do know that it's very susceptible to heat and very susceptible to bleach. Praise the Lord for that. Okay, so direct contact with what? Well, body fluids and secretions, broken skin and mucous membranes, mouth, vagina, anal opening, etc. Contaminated bedding, sheets, clothes, needles, anything used in a medical sense that can be contaminated. Direct contact with, and I will say that there have been more medical personnel infected with this outbreak than all the other outbreaks combined. So this is an extremely virulent disease. Handling of bats and some primates has led, and they know this for sure, that fruit bats and other bush animals harbor the virus. And some countries like Guinea, I believe, have put a government ban on the sale of bats. And these are huge bats. I mean, these are ones where there's something to eat, you know. So it's a market. There's a market, and some people's livelihood is catching these and selling them in the marketplace. And even though they're saying you can't get the virus by eating, you handle it before you eat it, so it's still in a direct contact. And then burial and mourning practices, and again, here are cultural issues that are standing in the way of containing the disease. The disease is not contained in Liberia and in some of the other areas. It's not contained yet. So some of the burial practices, the culture is that the family prepares the body and they kiss the body, and this is part of the burial thing. And so And of course, if a government then comes in and says, don't do that, then everyone is skeptical and feels that the government, you know, you can understand big issues here. So, but World Health Organization and country governments are trying to impress on people, please don't do this or use the protective clothing. But, you know, that's going to be impossible to do that. So common symptoms, the incubation is 2 to 21 days, 8 to 10 most common. And fever, headache, red eyes, rash, joint, muscle, stomach pain. So this defines about 3,000 disorders in developing countries. Weakness, vomiting, diarrhea, lack of appetite, and then unexplained bleeding and bruising. Usually that follows. It takes a particular period of time before the lining of those blood vessels break down, and then you start getting bleeding all over, inside and out, and through the mouth and through the nose. It's a horrible thing. So diagnosis, there's really medical, clinical, based on symptoms. If you're in an area where this is common and someone comes in presenting those symptoms, well, probably that's what it is. Definitive diagnosis is done in the laboratory, and there's 2 tests. There's what we call the ELISA test, enzyme-linked immunosorbent assay, which are available. You have to have the machine, but it's available in kits. And I can't remember. The other one is PCR, polymerase chain reaction. Both of these tests have been used for years in molecular studies. In a PCR is a way of amplifying. If you have a small gene or protein and you want to increase it, then you use a PCR technique to increase the amount that you have in order to test it. So these are done using an antigen against or an antibody against the virus. And so this is a definitive test for this. Dr. Mary says, and I've been in contact with Dr. Mary about some of this, and she indicates that both of these, if they're used individually, are probably more prone to give false positives or false negatives. They're not true. But if you use both, and they're both negative, that's a good chance that it actually is negative. And in very large centers that have electron microscopy available, you can actually isolate it and look at it in the electron microscope. But these are the tests here. Both of them are available in kit form, and I don't know if there are the numbers needed for the current outbreak. But there are several companies making these kits. One works in 48 hours, I can't remember which one.
So where?
And the other requires 30 minutes.
So something USAID or WHO, are they providing these tests in West Africa? I mean, this is like a world issue.
Yes, and so there is a flourish of activity trying to get diagnostic and treatment available.
So poverty is not a problem as far as trying to contain this. I mean, yes, it's a problem, but the world is trying to help get these diagnoses and contain them.
Correct. But just remember that this is a process with several orders of individuals involved or groups involved in getting out the information. Kits, and that's potential graft. So it's just like when we were in a year and a half ago in Liberia, visit a small community that was supposed to get mosquito nets free. And so one group comes in and the names that they wrote down were not the names there. So when the group came in to distribute the nets, they looked through, well, we want this name and this name and this name, and they went, well, there's no one nearby that name, so they take the nets and the village doesn't get it, and of course they sell it. And so, you know, there is a concerted effort, and security has stepped up. The U.S. government has offered military to help provide security in these areas. But treatment is supportive therapy for the symptoms. There is no approved therapy yet. There are multiple companies, Canada, US, Glaxo, SmithKline has a treatment that is in safety trials right now as we speak. If it all goes well, they are hoping to have 10,000 treatments by the end of the year. But when we're starting to talk about multiple thousands, that isn't going to do it. And that's a treatment, it's not a vaccine. There are several labs around the world working on vaccines in the US, in Europe, Israel, and these will be vaccines based. What they have done is they've tried to find survivors from previous outbreaks and find the survivors and get blood and find out what antibodies are there, and then build. And most of them are going to be multiple antibodies, not just one thing, but multiple antibodies. So supportive therapy, balancing fluids and electrolytes. And of course, these things are not going to be easily done out in the village. You're not going to be able to treat. So transport is a problem. A lot of the hospitals have been closed. So someone that feels they're getting sick, they get a cab to take them to the hospital, which is closed, and then they go from place to place to try to find some place that will take them in. Meanwhile, they're transmitting the virus. So there's a link in there, and I'll go over this in a minute, but one of the links is this, which was updated in March by World Health Organization, and I think this is the one. It's a 209-page guide for Africa for hemorrhagic fever. And when you look at a couple of pages on there, page 24 and 25 is a guide for all of these symptoms and the suggested treatment for it. And of course, this is going to be done in a clinic that is treating them. And also, each of these categories has a link for further information. And so that's on the sheet. I'll just talk about that in just a second. So protection. Here's another guide done in August by World Health Organization, August 2014. That's on the list as well. And this will have. See if this is. And then here's another one by CDC and World Health Organization. This is older. This is 98, based on the first major outbreaks, and it's still very good. And I can show you this in a minute. And this has a guide for a clinic. It shows you how to put on the protective gear, how to wash your hands. More importantly, how to take it off. Doctors Without Borders has been dealing with hemorrhagic fever for many years, including the early breaks of Ebola, and they have a team, a buddy team set up so the two people do it together. And so you read through the protocol, one person while the other person takes off in a certain way all of this stuff, and vice versa when they get ready to put it on. So just to not take any chances. So this is a shorter guide, I believe. And then the links. And what I'm going to do real quick, this is the last thing. And let me just get out of here. My screen is smaller here when I use the projector, so bear with me a second. Get rid of some of this. No. Okay. right now. This is what you have, and let me just walk you through a couple of these. So, links. World Health Organization, when you go to their site, this is their main site, and it's updated constantly. There's information here. This is the particular one about Ebola, and statistics are there, information, links to a gazillion things and reports, et cetera, et cetera. So that's a good one to just bookmark, and you can frequently go there. The other really good one is the CDC, and this is the CDC's Ebola site. And so this is updated continually, and I will say that there is, if you have medical training, you're licensed, nurse, physician, etc. CDC has a training, a 3-day training program for people that are going to be working with Ebola. And so it's, I think it starts next week, so it's Monday, Tuesday, Wednesday for the next, into December, and probably they'll send it. And I just got a link the other day that there is an organization that is supplying funding to help people travel to the CDC site for that, because they're crying for medical personnel to go over there.
Yeah.
So, but they're limiting it to medical people who are licensed. So that's a really good one. USAID, they have, and this particular one is for, of course, for the Ebola, and there's information there, lots and lots of links, etc. So that's really good. And then one thing that I find helpful is ProMed, the International Society for Infectious Disease has a reporting system in it, and you can all you have to do is put your name and email and then subscribe, and then you can get lots of information every day, which I don't have time to go through that. So one of the options, if you go up here to subscribe, and I would suggest anybody working in a developing country now, since we don't know where Ebola is going, I mean quite literally, it would be good to keep abreast of information coming in. Not as fear, but once it hits, it's too late to plan. So you need to start planning. If it does come, what do we do?
Okay, and just kind of building on that, I know that both the WHO and CDC do statistical modeling and for projection stuff. Is anybody sharing what they're looking at as possible growth and how it can move?
Yeah, you find it on these sites.
Okay.
So it is available. So if you hit subscribe, I'll just show you what. So you just fill that out, and then down here you select what you want. And what I get is a weekly update, comes every Wednesday morning, and it's a summary with links. And so you can just flip through